Hey, good morning, home health heroes. This is Amy Register with my mom, the home health mentor, Teresa Register. We are getting started a little bit late today. I've got heavy fog out here and some internet issues. So if my audio is garbled, you'll know why. I'm going to try to let mom talk most of the time today. And so, Teresa, thank you so much for all the work that you've put in. We were talking earlier about what you wanted to share today and how it's kind of a somber message, but we ended up thinking that this would be helpful. So take us through Omicron and what it means to home healthcare right now.
Okay, and Amy, you're coming through just fine on my side, so hopefully you can make comments if you want to or need to help me
Okay,
clarify.
thank you.
Sometimes I make some
All right.
assumptions, and it helps if you ask some questions. So, yeah, today's broadcast is a little bit difficult because we are living in very sober times, and I'm hearing from a lot of my contacts in the health professions that they're feeling more stressed than ever before. And from my own personal experience, I've never seen this level of concern and stress in the healthcare industry. So, some people that I've talked to are owners of home health agencies, others are clinicians and managers that are working in home health. And with all the uncertainty about what we've been experiencing over the last 2 years, as well as the new COVID variant, there seems to be some real um, concerns over what the future holds for many of us and for the patients that we're trying to take care of. Um, so a few months ago, when all of the announcements started about the need to be vaccinated, I got some letters from some friends who I've known for many years, and I've known of their religious beliefs, and I was asked by them to help them write some letters that they were using to request exemptions. So I wrote some samples that were based on what I knew about these friends and some of the things they told me, and I offered those on our website as well as in a couple other group um, sites. And I personally sent out over 160 copies of those letters, which tells me that there is an unprecedented level of concern about not only the vaccine mandates, but about our healthcare workers being able to continue in their jobs. So many of the people that I've talked to have been in the industry for, many years. And now all of a sudden they're feeling like they're either going to have to shut their agency down, or not only because they're living with some of these mandates and some unusual situations they're dealing with as a result of COVID, but they're losing valuable staff who are not wanting to be vaccinated. So that's just really a part of the picture. We know that COVID has turned basically the whole world upside down, and it is threatening healthcare in our country as well as every other one. Um, so yeah, it's becoming increasingly clear that we are nowhere near the end of the threat of COVID to the world, our country, and our jobs. So I thought I would take a minute and talk about the Omicron variant. It's known as B11529, and it is the newest variant that's circulating mostly in other parts of the world, but we have had now some cases in the United States. There are at least 30 mutations in the spike protein alone on this variant, and many more in the nucleocapsid, which is the round part of the virus. So altogether, we think that there's at least 50 or more mutations from the original wild type of this virus. And that is what is really scary to a lot of people, because it's that spike protein that the virus uses to get into the cells that it infects. So it's one of the reasons they think that the new variant is being able to spread so much easier and faster. And just a little recap of where we started with this virus. From the wild virus to the alpha variant, there were 11 mutations. To the beta, there were 10 mutations to the spike. To the gamma, there were 12. To the delta, which has been the primary variant we've dealt with in the United States, there were 10 mutations. So now you can see, or you will understand, that the Omicron variant is a lot higher concern, with over 30 mutations to just the spike protein. So that's really got healthcare people concerned, but it's also affecting our financial situation. And they're concerned that it's going to be kind of a chess game, I guess, where a new variant is found, or arrives, and then people are trying to quickly develop a vaccine against it, and then another variant comes along, and another vaccine, and more boosters. And so it's easy to understand how people are getting really concerned about what it looks like for the future. So yeah, we're experiencing another period of time where we don't know what this new variant means, as far as what it's going to cause as far as illness, and how it's going to be treated. We don't know if current therapeutics will work or not work. We don't know if natural immunity is going to protect some people or everyone, and if so, at what level. So there's just a lot of unknowns that is feeding the concerns and the period of uncertainty. What we do know, probably, and I say probably, but I think everyone pretty much agrees now, that we are not going to vaccinate our way out of COVID-19. It's going to continue to mutate to avoid the vaccines. There's going to, that's a known characteristic of viruses, that as soon as you try to develop a vaccine against them, they will mutate, and we don't know if they will become more virulent or less virulent. In natural immunity, they become less virulent, but with vaccines, there's a possibility that they become more virulent, and I think that's what we're seeing with this Omicron variant is, 30 spikes or 30 mutations on the spike protein is of concern. It's not something we've seen before. So it is likely here to stay. And as I said, we're still on the front end of it, so we don't really know how it's going to affect healthcare as a whole. But we do know that there is a likelihood that there will be more and more demand on the healthcare systems. And that means on home health, on hospitals, clinics, doctors' offices, everybody's probably going to have to gear up for another period of time where there's going to be more and more patients needing care, and maybe in the face of lower staffing, and we may experience another problem with getting enough personal protective equipment. So we're getting into what we would normally consider the pneumonia and flu season, as well as dealing now with this new variant. So there is a concern that there could be more and more demand, and yet we're at a time when we may be struggling with resources. So another concern that healthcare facilities have is when we have more demand, there can be delays in payment. And of course, sorry, of course, at a time when home health agencies are facing narrower margins of financial payment, it's even more concern if you have delays in payment for claims that are being submitted. So, what's happening in home health? Well, as I mentioned, I've talked with some owners who have made a decision to close their agencies. And one in particular that I've been communicating with has been in business for over 30 years. And it's sad, and she's really emotionally, struggling with this because she's dedicated so much time and resources in this business, and now she is in the process of discharging and transferring patients to close her business. So sadly, she's not alone. There's other people who are in the same boat. Given the extensive regulations.
It's hard to decide if it's,
Go ahead.
It just seems like it's a tough time to decide, if things aren't going as well as you thought, and you've put in, so many years, and you're thinking about going out early. It sounds like we might lose some people who are just tired of fighting.
Yeah, I think that is very much the case. There's just been so many challenges, as you know, and probably anyone who's listening to this knows there have been, changes every year to regulations and reimbursement. And, it feels like payers are tightening the screws, expecting more for less money, and, thinking that we can fix all of our problems by being more efficient and, having technology. And the truth is that's really not the case. You can't substitute the personal interaction, and that time is expensive. That time and the training that health professionals go through to give them their knowledge base is not, it's not cheap. So there comes a time when you just have to understand that this is what it costs to do this kind of care. So there's agencies that have struggled, and they've put as much as they can into their efficiencies of their agency. They've cut staff, or they've done something with contractors to try and be more efficient, do more with less. But there are a lot of agencies that have just said enough is enough. We've done what we can with what we have, and this is just the straw that broke the camel's back. So agencies that do stay in business, and there will be a lot of them. There will be agencies that survive all of this craziness. But I think there's some things they're going to have to recognize is probably going to be the case. Staffing is going to be more difficult. It's going to be harder to recruit people. Um, and to recruit people, it may take, higher pay because they're putting themselves at risk. They're putting themselves in a situation where they're going to be functioning under, pretty difficult circumstances.
Mhm.
So I think it's going to be a little bit more challenging to not only recruit, but to retain staff. And there's going to have to be an adjustment in the way we do things. We've already seen a lot of internal operations that have had to change. We're doing more telehealth, we're doing more things remotely.
Mhm.
Um, there's, the staff have to take their own temperature and check their symptoms every day and report in. And there's there's differences in how we train. We used to be able to train in a group. We used to get together for staff meetings in person, and some of those things have gone by the wayside. We're going to have to spend more on personal protective equipment, and getting it may be a challenge. Um,
Mhm.
anyway, there's just a lot of things about the way we have done things in the past that we're going to have to do differently.
Mhm.
And that's going to take some adjusting. And people who have been in the industry for a long time may have a harder time adjusting to some of the new normals.
Mhm.
Um, Instead of, just reviewing our standard precautions and how we do hand washing and bag technique and all that kind of stuff. Now, the training is going to be a lot more focused than it was in the past. Not that, we ever didn't cover standard precautions when we oriented and trained people, but now it's going to have to be meticulous. And so that's going to put more demand on our educators.
Mhm.
So yeah, home health will be different now that we are pretty sure COVID is not going away. When it now seems to be a permanent part of our work and workplace environment, and as challenging as it will be to provide home care in the current environment, it's unlikely that other areas of healthcare will fare any better or much better. So every part of our healthcare industry is going to be challenged. I had mentioned to Amy earlier that in some cases I've heard of nurses leaving hospitals because the hospital was requiring um, vaccinations, and there are some home health agencies that were not making that mandatory. And then CMS came out with their requirement and said, now this is going to be a condition of participation, which to those who are in the industry, we understand that Medicare is one of our major payers. It is the major
Mhm.
payer.
Mhm.
And so if CMS says now, this is what you have to do, or you won't get paid, then that obviously means if you don't do this, you might as well close your doors because you will not
Mhm.
get paid and you will not be able to function. So it's been scary, for a lot of home health agencies once that mandate came out of CMS. Um, and as probably most of the people know, in all 50 states now, the mandate has been placed on temporary hold until it can be challenged. And I believe it will end up in the Supreme Court. I think that's pretty much the general consensus is that this is not going to be decided on a state by state basis. It's going to have to go to the Supreme Court to determine whether or not a government entity has the right to make a, quote, law that requires people to take a vaccination. So that's, that's still to be determined. And at the moment, I know our agency has said we are not doing any, requiring vaccinations. However, if someone wants the vaccinations, we are providing access to funds or circumstances for them to get it. And we have given people 4 hours off when they need to go get a vaccination. And we're continuing that for people who want to do it. So we're just on hold. And I think a lot of the agencies that have been paying attention to the legislation and court cases are aware that right now there have been decisions that cover all 50 states for both CMS and OSHA, and all of that is currently on hold. So as we go through this maze, I guess I would call it, those of us in the industry need to really try to support each other, talk more, share more. Sorry, I am choked up. We should do whatever we can to keep our patients informed and protected. And I think owners who are wise will continue to keep their staff informed and just be transparent, be honest, let them know what you are dealing with as an agency owner. And if you're a staff member, you need to keep your administration aware of what's going on and what your concerns are. And hopefully we will survive this this period of uncertainty, and maybe in a couple months maybe things will look better, hopefully. And I just hope that we will keep positive and try to do, whatever we can to support each other.
Yeah, it sounds like their home health, especially for those who've had better times, in for a miserable winter kind of feeling. But like you said, for new people being recruited, and it's still good money. It's still, you find a great agency. It's still a family. You're still doing awesome work, uplifting work. And that's something I was thinking about through all this, that there are people in this who do home health as an extension of their personal mission to bring other-centered love into the world and to just bless people. And so for those of you that's your call and that's even your ministry in some situations, that you're doing for the core of your being, serving, your creator, your God. Thank you. And do remember that, I mean, I know you know this, but some people are just dying for any kind of brightening word, any kind of tender touch, any kind of softness of heart. I mean, I know you see patients that are, even if there's people around them in their homes, they're alone, and there's people who are truly alone in this world. And so the need for caring home health care workers is greater, even as the challenges are more demanding. So thank you for doing what you do. And thanks, Mom, for laying out the realities. And yeah, it's a big question mark, isn't it?
Yeah. And thank you for pointing out that a lot of the reasons that we do what we do has nothing to do with with finances and billing and all that kind of stuff. It's definitely a
Yeah.
mission and a ministry.
We still got to make it work though. So I know that
Yeah,
there is a balance there. You can
yeah.
still,
People like to get paid.
yeah. Yeah.
Even people who have love in their heart need to buy groceries. So
Right.
yes. So thank you all again for what you do.
All right. That's it for us today. Thank you so much again, Home Health Heroes, for doing what you do. And our goal is to be back next Friday with another Q&A. If you want to talk about this or you have other questions, please go to Mom's Facebook page, which is facebook.com/the Home Health Mentor. And as she mentioned earlier, you can check out some of the exhibition letters online at thehomehealthmentor.com. We made them free for you to download, and probably will update them shortly. I would leave you the link, except my internet is not doing very well today. So I'll leave you to that on your own, and we'll see you next week.
Bye.